The Abundance Project recognises the abundance of community resources in southwest London and elsewhere. And what we want to do is to make sure that those resources, cultural green resources, community resources, are equally used by a range of different people.
The Abundance Project is an interdisciplinary project that brings together health, arts, social sciences, and it's a real collaboration with community organisations to address mental health inequity in underserved communities. And with underserved communities, we particularly are looking at ethnic communities, communities that involve refugees and asylum seekers.
Research has shown very clearly that culture and green spaces are really good for health and well-being. So we want to make sure that everyone gets access to the resources they need for their health and well-being.
The timing of the project could not be more timely and apt. We've had a lot of emphasis placed on institutional and historical injustice and racism that certain communities have faced, calls that we need to address that there needs to be social justice. And at the same time, we've had a big squeeze of mental health service provision. So this project aims to address that injustice, address those issues.
The Abundance Project recognises a couple of things. Firstly, that access to creative resources and green spaces is really good for people, for everybody, really good for mental health. And secondly, that not everybody has equal access to those resources. So what we want to do is we want to work with a range of communities that are currently underserved, so do not access those resources in the same way as more privileged communities do, to develop models for social prescribing that work for them, so that everybody can benefit from those community assets.
Kingston Voluntary Action works with Royal Borough of Kingston Public Health on a social prescribing platform which currently has over 700 services. What would be fantastic working on the project would be to find out who are the people accessing those services and using Connected Kingston and who are not. And why are the people who are not reaching out and using the services not using them? And then it would be great if the research can tell us more about how we can overcome those barriers and make those services, in particular those that are cultural and green services that could improve people's mental health. How can we make them more accessible for people who don't use them so far? Along those lines, it would be also very useful to find out if what we have is suitable, or whether the people from minoritized communities need different services that would be more suitable for them.
We have excellent resources and assets in terms of green spaces, in terms of art galleries, in terms of cultural spaces. And this project really looks at how we can break these abundant resources in the area of social prescribing and improve mental health inequity.